When Earl Berry came to us, he had already had a heart valve placed, and he had actually done well with it. It had lasted about 6 years at that point. However, that valve was starting to deteriorate, it was starting to narrow, and he was having symptoms of heart failure.
I got arteries that's blocked, partially blocked. They're not completely blocked, but it's not easy to get to my heart. Some of the routes you want to take, you can't get through.
In Earl's case, given the fact that he had previously had a transcatheter or TAVR procedure done, and they were unable to utilize the groin sites like we usually do for most of our patients, we had to take a more careful approach in looking at him.
And we were able to come up with a plan in reviewing his imaging, all of his studies, that maybe we can access his heart valve through his carotid artery in his neck. So we discussed TAVR in TAVR, which is doing a TAVR valve inside of an existing TAVR valve, which, when Earl came to us, we had not done something like this before. However, it was done, it was, in the literature that, TAVR is done inside of a TAVR. Also that this carotid approach is a realistic approach that we had done before, just not all of those things together.
Earl is fantastic. He is caring, he's forthright, but he also speaks his mind. And if he doesn't understand something or if he's afraid of something, he's gonna tell you.
It really had me worried there that I'm gonna be the first person that had a valve inside of a valve. And I know a lot of people's got heart valve replacement, but they don't have them inside of another heart valve. That was the thing, and I said, I'm gonna be the first person out here doing this.
The whole team kind of met with him, including the valve coordinator, the surgeon, myself who would be doing the carotid cut down, the cardiologist, Dr. Das, and everybody met with him, reassured him, and we did extensive planning. And I think that gave him the confidence to move forward with this.
Every time I went in that office, the first question I would ask, is this doable? Is it doable? And everybody's saying, absolutely. And I thought, okay. They feel confident that they can handle this. And I kind of fell right in behind them and said, let's do it.
Procedure itself went beautifully, and he was up and bounced out of the bed and is going strong now. He's back to doing his hobbies, is working on cars, and it's just ecstatic to see him being back to a normal person.
Even though it was the first time the procedure has been performed like that, but it worked out okay, and I'm glad I did it, and if I had to do it all over again, I'd do it again.
We are one of the only community hospitals that do advanced heart procedures like this, and there is such a need in the community in North County through the advanced heart surgery techniques that Dr. Ray and his partner Dr. Munfa utilize, to the advanced techniques that we utilize in this hybrid room. Just greatly benefit the community and let them stay home.
I'm eternally grateful for the donors that helped make this room possible. Something like the hybrid room at a hospital like Christian Hospital really changes the landscape of what we're able to provide. The type of surgeries and catheterization procedures, endovascular procedures we're able to do here is far greater because of a room like this. So the room really plays an important role, and everybody that works in the room.
I like this hospital. It's easy to get around. They can get the job done here. The team here, they've done a good job for me, so I'm sure they would do a good job for any other patient that come in with heart conditions similar to mine. I've come here and I was near death. I couldn't breathe. I couldn't do it. But I walked out of here feeling good.
To see the transformation that he has gone through and things, and see him back to normal and enjoying life, it's gratifying.